Hi, so I'm Allison Venus, and this is my presentation on reality theory, sometimes called choice theory. So, as for the question who founded it or created it, William Glasser is credited as the main founder of reality theory. He started as a psychiatrist, and he completed psychiatric training at a Veterans Administration and the UCLA in Los Angeles in 1957, and by the year 1961, he was board certified in practicing psychiatry. One of the most early and most influential jobs that he did was he worked as a psychiatrist at the Ventura School, which was a prison and school for girls that was operated by the California Youth Authority. Through working with the girls at the Ventura School, he became aware that his training in psychoanalytic therapy and Freudian style psychiatry and talk therapy was very limited in helping the girls that he saw at the school. He found it best to talk to, as the book says, he found it best to talk to the sane part of the clients and not the disturbed side. As Freudian theory would suggest, you talk to the part of the brain that's disturbed and has the problems in the unconscious root. Glasser mostly got this mindset from his mentor, J.L. Harrington, which I'll touch on really quick because he's a big part of the theory. But J.L. Harrington was a psychiatrist also, and Glasser chose him as his mentor. And Dr. Harrington inspired many of Glasser's theoretical views, a huge inspiration. They worked closely together. So Harrington worked in a psych ward at Sawtell VA Hospital with veterans. And a lot of people thought these veteran patients were crazy, were really insensitive towards these people. Really insensitive. And people just thought, they're crazy, they're a lost cause, and they just kind of got thrown in psych wards, and people didn't really have any hope for their lives outside of it. It was really sad. And Dr. Harrington, applied talk therapy techniques when working with these so-called crazy patients. And Harrington came to the belief that patients weren't crazy, but rather they had learned how to appear crazy so they could stay in the psych ward. I thought that was really interesting. He basically believed that while no one is, I forget exactly what they say in the book, no one is completely in their right mind if they're doing something that gets them in a psych ward, but he didn't believe they were crazy. He thought that a lot of it was they had learned to behave that way, which I thought was interesting. So, a big part of Harrington's beliefs was he thought it was super important to get his patients involved in projects outside of the psych ward in the real world. So, instead of the emphasis being on what was going on inside the psychiatry sessions in the psych ward of the Veterans Hospital, the emphasis was on what are you going to do outside in your real life? How are you going to apply change in the real world? And he urged his clients to be involved and take charge in their own lives. And that helped to build his clients' confidence and the belief in their own power to change, which, to simplify, is choice. So if you had to sum everything that Harrington believed in and everything that he practiced down to one word, it would be choice. And that heavily inspired Glasser to create his theory. So the whole idea of choice, and people always have the choice in how they behave, was the huge foundation to Glasser's theoretical views. Another key point with Glasser is that from the very beginning, very early on, he rejected the Freudian model, which was the commonplace model at the time that how most psychiatrists and counselors were being taught to practice. And part of the reason that he rejected this model was because of his observations of psychoanalytically trained therapists who he thought were not implementing Freudian principles. To him, he said it seemed that they were holding people responsible for their behavior instead of carrying out therapy the way Freud had originally laid it out to be. And he was like, okay, I'm going to look into this, that's interesting. So Glasser believed that many Freudians were not following their own ideology, and he was like, well, what are they doing? We've got to figure out, a name for this, because it's not Freudian, whatever it is. And he noticed that they were focusing on responsibility, like holding the client responsible for their own behavior. And that was another huge inspiration for Glasser to create reality theory. So Glasser believed that clients should accept responsibility for their behavior, like total responsibility. He acknowledged that we cannot control what happens to us and like the families we're born into and the circumstances that happen in their lives, but we can control how we react and behave in response. He believed that people have more control over their behavior than they choose to believe and that they would like to admit. And people have a tendency to blame their problems on the outside. Like, it's not my fault, it's because of this, it's because of this. And Glasser challenged those beliefs and was like, okay, you're responsible for your own suffering. Which, a lot of the times, he would get a lot of backlash from that, from clients initially. Because they'd be like, what do you mean I'm responsible for my own suffering? Like, I'm in pain. And he'd be like, well, your actions, like what you're doing, isn't helping you get out of pain. If anything, a lot of the times these maladaptive actions that people adapt contribute to their suffering and prolong it. And he kind of helped people realize that. So another really interesting thing that Glasser believed is he did not believe that the term mental illness, as we use it today, should be applied to anything except for conditions that caused significant physical brain abnormalities. So the only things that he believed should be classified as mental illness were Alzheimer's disease, epilepsy, head trauma, and brain infections. And he said those people should be treated by neurologists. He thought everything else that we would technically label as a mental health problem today stems from maladaptive behaviors and are not illnesses, but instead are just behavioral problems, which I thought was interesting. Another inspiration for Glasser was he studied William Powers' control theory, and he expanded the theory so much that he ended up changing the name to choice theory. He did like lots of research on it, and basically the central theme of choice theory is that people have internal control. And in the book that William Powers wrote, where he proposed his control theory, it's called Behavior, the Control of Perception, he talked about how he compared the brain to like a thermostat, and it wants to keep like a homeostasis and maintain like a temperature, so to speak, in the analogy that he used to meet their needs. So the other main notable founder of reality theory talked about in the book is Robert E. Wobbleding, who greatly expanded off of Glasser's work and was a predecessor of him. He helped carry the torch forward. So Wobbleding's background was that he taught high school history, and he worked as a high school and elementary school counselor and served as a consultant to drug and alcohol abuse programs. So I thought that was interesting, because like he worked at drug and alcohol abuse programs, but it was for the U.S. Army and Air Force. So he worked with veterans. His mentor Glasser worked with veterans, and Glasser's mentor Harrington primarily worked with veterans. So this viewpoint greatly stemmed and was inspired by working with veterans. Like 3 generations of researchers, pretty much. Wobbleding is still alive, and he's still really active in the field. He's taught counselor education for 32 years. He has the belief, like he has a strong love for education because that's where his roots are from as an educator, and he holds the viewpoint that all students are highly motivated, eager to learn, and experienced, as the textbook states. How he met William Glasser was actually, he attended a bunch of his training workshops that Glasser used to hold in Los Angeles. And he became, like, such a good, like, student of Glasser that in 1988 Glasser appointed him as the director of training for the William Glasser Institute, which is really cool. So another really key thing that Wobbleding did is he served as a visiting professor at the University of Southern California, and he traveled to Japan, Korea, and Germany, and he spread reality theory and choice theory to those areas because people hadn't heard of it before, like there was no internet, so he was out there spreading the word. And he became known as an international teacher and an author and a practitioner of reality therapy. and helped introduce Europe and Asia and the Middle East to this theory. And not only did he introduce the Western version of the theory that we were practicing in the United States to these countries, but he also worked with people to help adapt the theory to be applicable in different cultural settings, which I think is super important, because otherwise it would have crashed and burned. You know, like if it doesn't correlate and work at all with the culture, and you're just trying to force Western views and like these Western practices onto other cultures, like it never would have worked. So Wobbelding is probably the key person, like the person most responsible for helping globalize reality therapy, like because it's all over the world now. Another key thing with Wobbelding is he helped moderate Glasser's extreme views about mental illness. So like I said, Glasser believed that mental illness was only like physical brain abnormalities. Wobbelding, on the other hand, as the textbook says, he advised counselors to follow standard practice and the standard of care regarding diagnosis and use of psychiatric medication. So he said therapists should absolutely comply with the DSM-5. In that way, he kind of softened Glasser's extremist points. So why was this theory created? Oh, where was this theory created? Sorry, I jumped the bullet. But Glasser founded reality theory here in the United States when working with veterans, and he was inspired by most of the veterans had come back from the Vietnam War, because his research started during the war, and after the war things were starting to get finalized. What need did it fill? Reality therapy was created because Glasser noticed that people make themselves miserable through their painting behaviors. He believed that people are the cause of their own suffering. And painting behaviors, I'll define that real quick. So painting behaviors is one of the concepts in the chapter. And it's described as when a person chooses misery. It's often subconsciously, but they are making choices that contribute to them being miserable by developing negative or maladaptive symptoms. So part of the ideology of like painting behaviors is, instead of saying that a client has symptoms such as a headache or they're depressed or anxious, a therapist who is following reality theory would say the client is headaching, is depressing, anxietying, sorry, that's hard to say, turning it into a verb. So instead of like passive, like, oh, I have a headache, that's not my fault, I didn't make a choice, it's headaching. You're doing something that's causing the headache and contributing to your own suffering, which is interesting. I think that's a really interesting point. And that belief is that the client chooses these behaviors because although they end up hurting them in the long run, somewhere in their mind they think those are the best options at the time. And a lot of the times those behaviors seek to make the person aware of unmet needs that are the root of the problem. So So, back to the need that reality therapy filled, I would say that reality theory differed from other theories at the time in that it was mainly focused on the present, whereas Adlerian and psychoanalytical theories were focused on like childhood development in the past and like uncovering and working through past trauma. Reality theory was focused primarily on the present, but also planning for the future. And reality theory expanded on some previous theories. I'll go into depth in that right now, actually. So it built on some concepts from existentialism, especially Viktor Frankl's belief in man's search for purpose and meaning in life. Wobbelding incorporated that into reality theory a lot. Reality theory built off of Adlerian concepts, primarily the emphasis on changing the structure of schools and education. Reality theory was used a lot in the education setting. And reality theory also built off of client-centered therapy in that it also focuses on building clients' confidence in themselves and building their courage to take charge in their own lives. So the next question was, when did the theory come about and what was going on in the world? And I already kind of covered this, but this theory came about during and in the immediate aftermath of the Vietnam War through working with veterans. And what was going on with the world is Vietnam kind of divided the country. Like, it was There was civil unrest, there was protest, it was a whole thing. And people were engaging in a lot of maladaptive behaviors, more than had been noticed in years prior. So William Glasser first began to give public lectures on what he called reality psychiatry before it turned into what we know as reality therapy. And most of the people that came to see his lectures were educators. And because of that, he adapted his lectures and actually wrote a book called Schools Without Failure. So he adapted to focus on the school setting. And that book had a major impact. As the book says, the textbook says, Schools Without Failure had a major impact on the administration of schools, the training of teachers, and the way learning is conducted in schools. So prior to that book, schools usually held a focus on failure. It was failure focused, and then that book helped change things to be success focused. And helping students, mostly children in elementary settings, adopt a success identity instead of a failure identity. So instead of believing they're a failure, I'm going to fail, kind of self-defeating, it was like, I'm a successful person, I'm going to succeed. And that really changed the way school systems are into what it is today. So reality theory is officially said to have been founded in 1965 because that's when Glasser published his seminal book, Reality Therapy, where he explains the theory. And once the theory was officially established, Glasser held intensive training workshops taken by people who worked in various jobs in the helping professions, mostly teachers. And that's how Wubbelding met Glasser. And I think it's really interesting because their paths probably wouldn't have crossed otherwise, because Glasser worked in like a veteran psych ward primarily. And up to that point, Wubbelding mostly was a history teacher, like a high school history teacher, so they probably wouldn't have crossed paths. I just think that's interesting. But some key concepts. So I guess I'll just explain reality therapy as a concept. It is the focus on a client's lack of relationships, or that their relationships are unsatisfactory. So relationships are a huge part of reality therapy. Glasser really focuses on how people are social creatures, and we crave social connection, and we want to feel like people relate with us. So clients often come into therapy complaining that other people are causing them pain. Like, they didn't get a job, oh, that person didn't hire me, or I'm not doing in school, like, oh, that teacher doesn't like me, or like basically blaming their problems on other people. But reality therapist asks the clients to examine how they're causing their own pain through their choices, and how those choices affect their relationships with others. So basically being like, take a look at what you're doing and how you're behaving, and how that could be contributing to all your problems. Interestingly, and kind of loosely related, Glasser believed that we are not blank states. A lot of psychologists before his time theorized that we're born blank states and we're adapted by our environment, like we're completely just blank. Glasser believed we are born with 5 genetically encoded needs. So these are 5 really big concepts, and that these needs drive us our whole lives. And those needs are survival, or self-preservation, it's another term for it. Love and belonging, that's a huge one. That's a big drive in social dynamics. Power, or inner control. Not really power over others, but power over yourself and your own choices. Freedom, or independence, and fun or enjoyment. And so, like he said, survival, love and belonging, power, freedom, and fun. Those drive everything that we do. Whether we realize it or not, all of our behaviors seek to meet one of those needs. Wubbelding also expanded on that and theorized that there's a 6th need, which is purpose and meaning, which directly derives from Viktor Frankl's work. That purpose and meaning is what we seek to create in life, to give our life purpose and meaning. Ironically, it's kind of like a loop. Like, the search for purpose and meaning is what gives our life purpose and meaning. So the belief that because all behavior has a purpose, human beings have a need for meaning and purpose. That's a quote from the textbook. Another concept was quality world, which is considered the core of our life, and it's where we store information in our minds and we build organized files of what we want. So this information is usually stored in the form of specific images of people, activities, events, beliefs, possessions, and situations that fulfill our needs. So it's specific images from our own memories of things we've seen in our own lives that our brain basically saves as little snapshots of things that have helped us feel happy and fulfilled in our lives before. So basically things that helped us meet those 5 genetically encoded needs that Glasser theorized, which I talked about a minute ago. And that relates to the concept of picture album, which is where we store all of these pictures of our wants. Basically, reality theorists believe we have this little picture album, and it keeps all those pictures. And so when we think, oh, what do you want? Like, your brain automatically thinks of those pictures. So a big part of the process of reality therapy is assisting clients in prioritizing their wants and uncovering what is most important for them. So it's basically like having your client be like, pull out that picture album and let's look through it and let's talk about it. And like, what do those pictures mean to you and how can we work towards those goals? So a huge belief of reality theorists is that clients who enter therapy either do not have someone in their quality world, or they do have someone, but that person, they do not feel that that person that they have can relate with them in a satisfying way. So pretty much the client feels very lonely, very isolated, they're lacking social fulfillment, and they don't have someone in their life whom they would consider part of the quality world and the ideal world they've built in their head. Another key concept is total behavior, which is the teaching that all behavior is made up of 4 inseparable but distinct components, which are acting, thinking, feeling, and physiology. And those 4 things accompany all of our behaviors, the way we think, our emotions. Choice theory emphasizes acting and thinking, which makes this a general form of cognitive behavioral therapy. So because of this, choice theory, which reality theory, they kind of go hand in hand. They're kind of the same thing. Like, you kind of can't have one without the other. People consider that the predecessor to cognitive behavioral theory. It's a very general form of CBT. The emphasis is on what the client is doing and how the doing component influences everything else. Like, your actions, how are your actions influencing everything else? That's like the whole main point of reality theory. I already talked about painting behaviors. That's like headaching instead of headache, like turning things into a verb. And the belief that all behavior, the purpose of all behavior, is to influence the world to get what we want. Whether or not we realize it, every action we make, we are trying to get what we want. Subconsciously or consciously. The cycle of counseling is another really big concept, and it consists of 2 components. The first is creating the counseling environment, which is the counseling rapport and a good therapeutic relationship. And then the second component is implementing specific procedures that lead to changes in behavior. So that second part is the actual work. Like, what can we do to change these maladaptive behaviors that are contributing to your own suffering? WDEP system was developed by Wobbelding, and it's used to help clients explore their wants, that's the W, possible things they can do, that's the D, opportunities for self-evaluation, that's the E, and design plans for improvement, that's the P. The acronym SAMIC3 was developed by Wobbelding, and it stands for Simple, Attainable, Measurable, Immediate, Involved, and Controlled by the planner. Committed to and consistently done. And that's what he believes are the essential elements to any good plan. And responsibility, we talked about, huge part of reality theory. The client has to take responsibility for their behaviors and the way they react. According to reality theory, people hurt because they choose to engage in maladaptive behaviors that put them in distress and cause suffering. Basically, according to Glasser and reality theory, people are choosing to suffer. People hurt because they are choosing to hurt. I'm not quite sure I agree with that. I think there's definitely some things to consider in that. I think it's a really interesting viewpoint. I kind of touched on this earlier, but a lot of clients don't like when you tell them that. Like, if you try and tell them you're suffering, like you're the reason you're suffering, they get really defensive. And sometimes, though, they get defensive because it's hitting a nerve. Like, there's truth in it, and they know that. Like, they're contributing to their own downfall. But they don't like being called out on it, especially not at first. So according to this theory, how do people change? A direct quote from the book is, people can change by taking responsibility for their actions and becoming aware of how they react and the signals their behavior sends out to those around them. So basically, every action sends out a signal. Whether it's what we intend it to be or not, we're constantly sending out signals. And people have to take a responsibility and accountability for their own suffering and change their ways of behaving, those behaviors that fuel their suffering. That's the only way people can change, according to reality theory. So, instead of people being depressed or angry or worried, they are depressing, angering, or worrying themselves. Not external factors out of their control. They are doing it. And in order to change, clients have to realize that and change these thought patterns. So at the end of the handout, I included some quotes. And let me pull up, and a couple questions at the end. So 5 multiple choice questions. Who is credited as the founder of reality therapy? Sigmund Freud, William Glasser, Robert E. Wobbleding, or Viktor Frankl? I'll give you a couple seconds. And the answer was William Glasser. Second question is, what core belief distinguishes Glasser's reality therapy from Freudian theory? Is it A, behavior is determined by unconscious childhood experiences? B, clients have little control over their behavior? C, people are responsible for their own choices and behaviors? And D, mental illness is caused by repressed desires? The correct answer is C, people are responsible for their own choices and behaviors. Third question, according to William Glasser, the term mental illness should only apply to A, conditions caused by maladaptive behaviors, B, situations that result from poor environmental support, C, disorders that cause physical brain abnormalities, or D, emotional issues caused by trauma. The answer is C, disorders with physical brain abnormalities. Fourth question is, what does the WDEP system and reality therapy help clients explore? Is it wants, doing, evaluation, and planning? Willpower, desires, emotion, and personality? Wellness, determination, empathy, and practice? Work, direction, emotion, and purpose? The answer was wants, doing, evaluation, and planning, so A. And the final question, what is the primary focus of reality therapy? Is it A, exploring unconscious motives and childhood memories? B, understanding external control from others? C, examining present behaviors and taking responsibility for change? Or D, identifying biological causes of mental illness? And that answer is C. I hope you have enjoyed my presentation. I sure have enjoyed researching it. Thank you.